morning, friends. Today we are going to learn about implant radiology. Implant radiology comes in picture when we talk about implants and to see implant, how it is and if it is placed properly or not. This is the thing that implant radiology teaches us. The restorations of edentulous and partially dentate jaw using variety of implant retained processes has become a relatively common clinical procedure in recent years. The implants are usually made of titanium and they are two types of endosteal and subperiosteal. However, whatever the system used, radiology plays an essential role in preoperative treatment planning, post-operative follow-up and success evaluation of the implant which we have placed. So for that reason, implant radiology is important for us to read. Main indication what we advise about implant radiology is like implant, replacement of missing teeth in patients with healthy dentition who have suffered tooth loss because of trauma, free end saddles, developmentally missing teeth, remaining teeth not suitable as bridge abutments, and severe ridge resorption making the wearing of denture difficult and severe gag reflex, cleft palate and insufficient remaining teeth to support a denture obturator, reconstruction following radical ablative jaw surgeries, a desire to avoid wearing a removal processes because sometimes it creates very embarrassing situations. Treatment planning considerations. A thorough clinical examination, usually study cast, and overall evaluation of the patient are essential. As good case selection, it is imperative for a long-term success of the implant. A multidisciplinary approach involving surgeon, prosthodontist, dental technician is often adopted because of many important factors that need to be taken into account. The patient's age, general health, and motivation, the condition and position of the remaining teeth, including their occlusion, the status of periodontal tissues and level of oral hygiene, the condition, quality, and quantity of the edentulous mandibular or maxilloalveolar bone, the condition of oral soft tissues. Now, what are the radiographic examinations which we go through? A comprehensive radiological assessment of underlying mandible or maxilla is necessary. The main investigation in radiology which we include are standard projections. In those standard projections, periapical radiography, panoramic radiography, occlusal radiography, and cephalometric radiography. This is a radiograph, IOPA. In that in IOP we can appreciate more of resolution. It is best for single implant. You can see near abouts and how much it is the normal anatomic landmark is seen. So in this type of IOPA is good for single implants before and after the implant placement. Here in the we can see in upper maxillary how far is the maxillary sinus lining, what should be the vertical height, how is the orientation, what is the mesodistal width. This is before implant placement. We can make planning of implant placement. This is a panoramic radiograph used for post-operative assessment of multiple successfully restored root form implants. You can see so many implants are placed and for that reason OPG is required. Now, what are the specialized projections? One is tomography, that is conventional or computed, or cone beam tomography. Here we can see a 3D cone beam tomography. In that we can analyze how far is the canal and how many implants can be placed. So this is a post-operative CBCT. So this can very well patient education as well as the patient evaluation. This is a cross-sectional CBCT. In that we can see how well the implant has been placed, how much density bone is having. This can be seen. These various radiographic investigations are used to show the position and size of relevant anatomical structures including inferior dental canals, mental foramen, incisive or nasopalatine foramen, canal, nasal floor, shape and size of entra including the position of entral floor and its relationship to adjacent teeth. The presence of any underlying disease, presence of any retained roots or buried teeth, the quantity of alveolar crest, basal bone, allowing direct measurement of the height, width and shape. The quality or density of the bone is also measured. The amount of cortical bone present, density of cancellous bone and size of the trabecular spaces. Post-operative evaluation follow-up is also done. In post-operative evaluation, it can be carried out immediately after the surgery and after the initially 4 to 6 months is the healing period. In that also evaluation is to be done. Later on, we can clinically evaluate the success or otherwise of the implant including radiographic assessment. It should be carried out in annual basis for the first few years and then biannually. So conclude, I would like to say that endoosseous dental implant therapy, it is efficient, predictable, but cannot be performed in all patients. The clinician must evaluate each candidate and site comprehensively. The evaluation includes exclusion of pathology, identification of anatomic structure, evaluation of the alveolar bone, and failure to evaluate accurately. Complication including inability to place an implant is always there. So, we know that implant radiology is very much important for implant placement. So, for this, I would like to end this lecture and we'll meet sometime. Thank you.